When you mentioned low testosterone, I have heard so many different numbers of what that actually means. So what does that mean as far as the lab numbers? Because some people say it's like, oh, 250, and other people are like, no, that's way too low. So I'm just
Yeah.
curious.
Yeah, that's a great question. So it the answer is it depends on which organization that you look at. So I think it's the American Urological Association. Their cutoff is 300. I believe they're trying to move it down to 250. So anything under 300, and the criteria for insurance purposes. So if we were to want to put you on testosterone replacement and you have insurance, the criteria for that is under 300 for 2 consecutive blood draws, and they have to be within a 2 week period. So if you have two of those measurements under 300, we can technically diagnose you with hypogonadism or low testosterone and put you on testosterone replacement. Now, it's never always that simple, but that's kind of the criteria here in the US. Now, I disagree a lot with this just because we see evidence from other associations around the world that this is way too low. And a lot of those other organizations, 350 is sort of the cutoff. And they actually have some stipulations on free levels of testosterone, which I think is a much more functional measurement of testosterone. Because I see plenty of guys who have a technically like normal total testosterone. They may be in the 400s or so, but their free levels are very low and they have all the symptoms of low testosterone. So functionally, they are low T without being sort of officially low T. So what my criteria is typically is any guy under about 350 with symptoms too. So I give them a questionnaire. And if they say yes to a certain number of questions on that questionnaire, it's called the Atom questionnaire. And I look at their free testosterone levels, and if they're under about 10% or the 10 number, then yeah, they have low T for all intents and purposes, and that's what we're going to treat them for.
Interesting. Thank you. I was just curious because like every time I talk to any doctor, it's like I get a different number. So it's nice to hear from an expert.
Yeah, I see this all the time where, they go into their primary care and they get their labs done and they come back and they're at 310, and if you go through all the symptoms, they have all the symptoms, of low testosterone. And they didn't do a free testosterone, they just did the total and that's it. They didn't look at DHT or estradiol or any of those other metabolites. And so you don't really get the full picture unless you're doing all of that. And so I think our statistics are sort of underreported because we're not getting a good picture of what men's testosterone health actually looks like, because we're just doing these very cursory lab values, and we're not doing questionnaires, we're not looking at symptoms as much. So yeah, I think we're making progress, but we still have a long way to go.